My name is Rachel Flum, and I'm a policy analyst with the Economic Progress Institute. And today we're going to talk about the Child Care Assistance Program here in Rhode Island and suggestions for improvement that people have offered. With me to talk about the Child Care Program are Leslie Gell, who's the director of Ready Learn Providence, and also serves on the Early Learning Council and on the Permanent Legislative Commission on Child Care. Thank you for being here, Leslie.
Nice to be here.
And also we have with us Chaz Walker, who is an organizer with SEIU 1199 Northeast. And in that work as an organizer, Chaz works both with healthcare workers and with family home providers. So thank you also for being here, Chaz.
Great to be here with you.
So let's start by talking about the role that child care plays in the lives of working families, the future success of children, and the state's economy. So Chaz, we'll start with you. Can you tell us a little bit about the need for child care, both for families and for businesses and the state in general?
Well, child care is a fundamental need for working families in Rhode Island. In 1199, we represent about 3,700 healthcare workers in the state, but for all working families who have young children, it's really important in terms of supporting parents' ability to go to work. Close to 72% of families in Rhode Island that have children under 6 have either both parent or the single parent in the workforce, at least part-time, and so they need child care. And the costs for many folks, especially of accessing quality child care, is very prohibitive. It's the cost essentially of tuition at a public college. And so we know that early years are really important to children's learning, but for many working parents, it's really a struggle to afford it. So the child care industry does contribute in a major way to Rhode Island's economy. There's about 700 home-based child care providers and about 400 child care centers who, collectively there's probably thousands of workers and tens of thousands of families that are supported in addition to the work that's done with children's early learning. So it's a key component to our economy, but it's one that many working parents are sort of stretched to afford, and people really do sometimes express this feeling of relief when your children go into public school for the first time, because that some of the cost of childcare and early learning is eased off there. So
certainly I can attest to that personally. It is a big relief when you jump that hurdle and don't have the full-time child care costs, although also families do have the after-school care cost for a few years after that. So Leslie, in your role at Ready to Learn, you work directly with children and with families, and you really can see the important role that child care plays in future success. Can you talk a little bit about that?
Sure. So when we say child care, Rachel, we're talking about children's early learning years. So we struggle with nomenclature in our field, and so we have child care, and we have daycare, and we have pre-K, and we have early learning. But all of these, whether a parent needs it because they work or not, child care plays a critical role in children's early learning. And we know that when children go to kindergarten, it makes a critical difference whether or not they have attended a high-quality early learning program or not. And research demonstrates that when children attend high-quality learning programs, that they are far more likely to enter school, reaching the benchmarks that they need. And then that carries on through 3rd grade when it becomes so critical that children are able to read by 3rd grade, and you can follow it right through high school graduation and beyond. So while we talk about childcare as meeting a critical parental need, because parents have to work, it's really important to also focus on what children are getting. Mm-hmm. More and more research has been done in recent years about how the brain develops, and whether you're talking about an infant who is 6 weeks old or a preschool-aged child who is 4 and has one more year before they go into formal schooling, it's so critical that they're in a high-quality early learning environment.
Mm-hmm. Well, and certainly we're going to talk a little bit more about quality environments as well, and a little later in the show. But Chaz, as you mentioned, there is an extraordinary cost oftentimes for childcare, and as you both know well, the state does offer child care assistance for some working families, for low-income working families. And the goal of that program really is both to help families pay for child care and also to let them be confident that their children are in safe, regulated places while they're working, either in the setting or in the family home care setting as well. So, Leslie, can you start by telling us a little bit about the state's Child Care Assistance Program, or CCAP as we call it, and how Ready to Learn works with families and providers in that program?
Sure. So CCAP started, it's a program that comes out of the federal government. It started in the late 90s under the Clinton administration as part of welfare reform. And the idea was that if we are going to get families off of welfare and into jobs, then they need critical supports to make that happen. And one of the most critical supports is access to child care. And so through federal block grants, states were able to receive dollars in order to help families pay for their child care. And so here in Rhode Island, we call that the CCAP program. And throughout the late 90s and into the 2000s, we had a really robust program that at one point, up until 2007, families whose incomes were up to 225% of poverty were able to receive assistance from the state of Rhode Island to help them pay for child care. And depending on their income, they had a modest copay, so that if they were right at the poverty level, they would have no cost share, but as their income rose up to 225%, they had a copay to pay. Unfortunately, that program was really slashed in 2007 when we experienced some very dramatic budget cuts, and we saw literally thousands of families lose their access to the subsidy program. And so right now, only families whose income goes up to 180% of poverty are eligible to receive assistance. This is terribly problematic for families, for children, because they lost access to their early learning programs, but also for the field, because it meant that many programs had to close, many family child care providers had to close their doors, centers had to lay staff off, and so you saw the economic impact not only for families, but for the field as well.
Mm-hmm. And just to put those numbers in context, I believe 180% of poverty is a family of three is earning about $34,000. And I know too that the other New England states all have higher eligibility limits, which is both a recognition that it is a recognition that Rhode Island isn't doing as well as its neighbors, but also that other states recognize that even families with higher incomes still need supports to pay for childcare.
Right.
So, Chaz, Leslie talked a little bit about those cuts. Can you talk about how the industry that you spoke about earlier was really affected by the cuts to the program?
Yeah, sure. So, I mean, especially with family childcare, but I think it's true across, many settings, these cuts have destabilized the field. It's, unfortunately, low wage, kind of high turnover industry, and these are folks that are, working to provide high quality early learning experiences for our young children. But actually, about 700 family child care providers since the cuts went into effect have gone out of business, have closed their doors, which has restricted access. Made it harder for more families to have the options when they're looking for child care, and especially for parents that are returning to work, restricting their ability to choose, the setting that they would like for their child. Family child care providers, about 30% of parents in the Child Care Assistance Program choose family child care providers.
So under the Child Care Assistance Program, a family can choose what kind of setting they want their child in, either family or center.
And many parents choose family child care because of the individualized attention, but also because of the flexible hours. Oftentimes family child care providers are open in the evenings or are willing to care and educate children on weekends, and that is really important for parents in the healthcare field or in many of the new jobs that are kind of coming back to Rhode Island or that we're hoping to build. And so family child care, plays a key role there. But there's 4,000 fewer slots than there were in 2006 or 2007. So that, as we rebuild our economy, it's really important that we help to rebuild this field and really raise it up.
And just to circle back to what I said before, so if a child is in a high-quality learning program and the parent is being helped by the subsidy program and now this family loses their job, the implications for the child are tremendous because they're being pulled out of this program. So if you can imagine a 4-year-old who now is going to be entering kindergarten the following year, the family loses their job in October, and now the child loses their child care, which is their early learning program, and now they they are going to be going months before they enter kindergarten. So they're really losing critical time. So it's really important to view this not only as a support to parents financially, but as a support for children and their learning and development.
Yeah, I would agree with that completely. I think that the 7,000, fewer children that qualify for child care assistance now since we restricted eligibility, no one knows what kind of early learning experience they had after they lost access to, licensed, regulated quality care. And so, that was 2006. Those children are now in 3rd grade, 4th grade. We're trying to see how are they doing in school, but nobody knows where they were in terms of their early learning experiences. And so if we're trying to make sure that our education system can succeed, there's really a fundamental piece of it that starts, as Leslie said, in those earliest years.
And it's really a consistency of care issue too. I mean, I believe the quality issue is only as good as the consistency. So if
Absolutely.
a family loses a job and then gets another job that has that break in between, it certainly would be hard for my children to switch back and forth, but for the learning environment, I imagine that's not ideal either.
Exactly. And so we were at a high of somewhere between 13 and 14,000 children who were receiving the subsidy before the budget cuts in 2007, and now we hover around 7,000. Now, we don't have dramatically less children in Rhode Island. We have the same number of children under the age of 5 as we had prior to 2007. And so where are these children and who is caring for them? And we know that having children in licensed regulated care, and ideally, and we can talk about this later, programs that can demonstrate that they're high quality through participation in Bright Stars and other quality improvement programs is so critical. And so having children, we know that there are the same number of children. Where are they? And getting them back into licensed care is so critical.
And there really doesn't seem to be good data about where they are, does there?
Unfortunately.
There's no requirement for tracking, so there doesn't seem to be good
Exactly.
information. So let's talk about quality now. I mean, obviously, one of the points of creating the Child Care Assistance Program back in the 90s was not only to make sure that there was child care for when people work, but also to make sure it was an early learning opportunity. And I know that now there has been an increased look at quality after the state won a national early learning Race to the Top grant. So Leslie, since you're on the Early Learning Council, can you talk to us about what the goals were behind that grant and what that means for changes in the state?
Sure. So as I said before, we know that when children attend high quality early learning programs, that makes a tremendous difference for their whole educational trajectory. But the key is high quality. And so the state, even prior to the winning of the Race to the Top grant, the state was putting a major emphasis on raising the quality of early learning programs. And one of the ways that the state demonstrated that was through the creation of a tiered quality rating and improvement system, which here in Rhode Island we called Bright Stars. And it's a way to measure the quality of early learning programs. And so before the state won the Race to the Top grant, we had across the state approximately 15% of programs, both family child care providers and center-based programs, participating in Bright Stars. It was voluntary. Thanks to the tremendous work that Rhode Island had done, both state agencies and community-based organizations, all in partnership, the state applied for a very competitive grant called the Race to the Top Early Learning Challenge Grant, and we were one of very few states that was selected. And it's $50 million that this state received in order to focus on the early learning years and primarily to improve the quality of early learning programs throughout the state, in particular programs that serve high-need children. And so over the course of the grant, it's a 4-year grant, the focus will be on getting as many programs as possible to join Bright Stars and providing quality improvement incentives to programs so that they can not only get into Bright Stars, but also develop quality improvement plans to raise the quality of their programs over time. We know that quality costs money. And what the state pays, in particular for children that their families are receiving subsidies, the rate of reimbursement that the state pays is quite a bit lower than the actual cost of care. And so we know that if we want to focus on raising the quality of program, we need to provide incentives for programs to focus on the professional development of their staff, to help their staff members return to school, because these are things that we know have a tremendous impact on the quality of early learning programs.
So, and I know that in addition to both the professional development, there will be funding for sort of physical space as well, improving the structure of different buildings and the different requirements in terms of what rooms should look like.
Right. So there will be quality improvement grants that allow programs to look at. All programs will need to have a quality improvement plan in which they focus on a variety of domains within their program, and they'll be able to apply for funding through the state to focus on a whole variety of issues that clearly have an impact on young children's learning.
So, one thing that has been mentioned here several times is access, and I know that in addition to quality, there's also been an increased focus in looking at access and opening access back up for families that was shut in 2007 when the eligibility rates were dropped so dramatically. Now that the state has a little bit better budget footing, there have been several bills that have been introduced this year. So Leslie, can you talk a little bit about some of those bills?
Sure. So one that we have been working on for years, really, ever since those budget cuts went into effect, is we call the exit bill. And this is, so what happens when a family loses their child care? They are getting subsidy, they're getting help through the state, and now let's say they get a raise. They get a 25-cent an hour raise, and so now they have gone from being at 180% of poverty to being at 181% of poverty. They automatically lose their subsidy, and so literally they fall off of a financial cliff, and their child care costs, they increase exponentially. So they may have a modest copay of $50 a week, and now they have to cover the full cost of care, which in many programs is, for an infant or a toddler, upwards of $200, for a preschooler, very close to that. And so the exit bill, which is sponsored by Senator Crowley and Rep. Diaz, is designed to allow families who are already receiving the subsidy to continue receiving the subsidy up until 225% of poverty. So they would come in at lower than 180, but not have to exit until they get to 225% of poverty. So we are hoping that we can introduce this as a pilot program so that the state can really see the impact of this, and then move towards scaling it up once the pilot is over.
And I believe that was part of the Senate President's Moving the Needle package as well, because of the importance to economic development as well.
And if I can say on,
Sure.
and it's similar to how the programs in both Massachusetts and Connecticut work in terms of having an entry, income level and then a higher income level that you can earn up till before you lose any sort of assistance. It's smart in terms of what Leslie talked about in terms of the continuity that a young child needs in a care setting, right, in their earliest years. It's really smart policy, and it's important that we try and move the pilot so that we can show the impact it's going to have.
We hear all the time about families who turn down raises. So it's not worth it to them to take that 25-cent an hour raise because their out-of-pocket childcare costs will increase so dramatically. So it's crazy policy to have families turning down raises. We need to do more to support families.
We get calls at the union all the time from members saying, "Oh, I need to cut back my hours. Can you help me get my hours trimmed so that I can qualify for child care assistance?" That's not smart economic development.
Right.
We should be encouraging people to work to pick up overtime if they have the opportunity, right, to increase their overall earnings. That's part of helping people become economically independent. This is one of the goals originally of starting Right. So we need to make sure that our policies really do reflect that.
And then another part of the CCAP program is that people are required to work 20 hours a week, and my understanding is that child care assistance only covers those hours when they're at work. So I believe there are a couple bills that
Right.
focus
So
on
another
that
bill that
piece.
was also introduced by Senator Crowley and Rep. Samini is a bill around education and training. So if a family is working or if a parent is working 20 hours a week, this bill would allow them to participate in training or classes at CCRI for additional hours and continue to receive, therefore, additional subsidy dollars to help cover the time that they are in training. So once again, this makes tremendous economic sense. We want to encourage families to return to school and to get training so that they can advance along a job continuum. It doesn't make sense to deny families the opportunity to do that.
Well, and certainly we're hearing a lot, even from the governor and sort of about the economic conversation about the importance of training. So I believe the third bill is also related to training.
Exactly. So the third bill would allow a parent who is unemployed to access a short-term job training program, and during the time of that job training program and a short period of time after which they would be seeking employment, they would be able to access the subsidy system to help them be in school, get that training, and then seek employment.
And I believe there was just an article I was just reading in Providence Business News about some of those training programs. They're called train-in-place programs, and so I think there's one at Amos House and then one in Woonsocket where they're tied directly to jobs,
Exactly.
so that they are trained and then they go directly. But right now, if you don't have child care assistance, parents can't participate, which doesn't seem to make a whole lot of sense, because the minute they get a job, they would qualify for child care assistance. So Chaz, there's also a separate piece of legislation that's been introduced this year that's focusing around both parents and the family child care providers. Can you talk about that?
Sure. It's the Quality Family Child Care Act. It's sponsored by Rep. Slater and Senator Goodwin. And what it would do is strengthen the voice of family child care providers and parents in improving the state's child care assistance program, so that some of these issues and many others that we haven't talked about in terms of access, affordability, and quality can come to the surface. It enables family child care providers to have a process through which they can form a union and advocate to increase training and professional development, advocate for more access for families, and really raise up their profession. And it also creates a parent advisory committee that would be able to meet with the state, made up of parents that participate in the child care assistance program, to be able to meet with the state in an ongoing way and talk about issues that are related to strengthening the system.
And so how would the process of picking parents to be on the committee work?
So what the bill says is that 2 would be appointed each by the Speaker, the Senate President, and the Governor. And so it would be parents who have participated in CCAP or currently participated in CCAP, or guardians. And so essentially any parent who has something to say about how to strengthen the system, whether it's how long the process takes to get your child care assistance approved, which can drag on for weeks when you're first applying for a job. It can drag on for months, and that's something that employers look at and say, well, how come you have to keep taking a day off of work to go down to the state office to get your child care situation straightened out? It makes it harder for parents to transition back to employment. So those types of issues can come to the surface when parents have a seat at the table. And then family child care providers are often struggling with the same issues, because that overlaps with whether or not they're getting reimbursed from the state for the costs of providing high quality child care and early learning to the children of these parents. And so enabling them to have an organization similar to what both Mass and Connecticut did last year, we think is a common sense way to strengthen the system.
So Mass and Connecticut have a similar policy?
Exactly, and family child providers in both states right now are meeting with their state's Department of Early Education to work out an agreement to strengthen the child care program there.
And you mentioned that one of the issues for child care providers would be increasing access. Why is that? Why are providers interested in increasing access for children?
I mean, first of all, because they're in this line of work because they have a calling to provide excellent care and early learning for these children. And they've seen what's happened since 2005, 2006, as the economy has struggled and as parents have lost access, that's affected their communities and the children that they're committed to serving. And so it's also obviously affected their businesses, as 700 of them have gone out of business. But in terms of expanding access, we view that as something that's important to all Rhode Islanders, because the cost of providing childcare, it's very challenging for a family. If you're making $35,000 a year, you're a family of 3, and you don't get any assistance, to have to pay close to $10,000 out of pocket is very challenging for people. As a society, we've decided public education is something that we're investing in, that we believe in. But somehow in the 0 to 5 years, we try to put everything back on the individual family to say, well, you have to afford that on your own, or you're going to get a small amount of assistance. We need to rethink the importance of those years in a child's future development, and understand these are investments, but they're important investments. The Chamber of Commerce actually in 2003, the Greater Providence Chamber of Commerce commissioned a study that found that for every dollar that we invest in childcare in Rhode Island, $1.75 comes back to our economy. That's not the labor union talking, that's the Greater Providence Chamber of Commerce. And we know that there's enormous returns long term in addition to the immediate economic impact. There's enormous returns in terms of children's future success in school and in life. So we view it as really important.
So, and I know we just have a few more minutes, but on the payment piece, the state does invest some dollars in the program, and then there is a federal amount that goes towards the program as well, the CCAP program. And you spoke a little bit about reimbursement rates, Leslie. I know that there is a market rate survey that is done every year that really looks at what the cost that providers are charging, what that cost is. And I believe the federal government recommends that child care providers are reimbursed at 75% of the market rate. Do you happen to know what the current rate
so
is?
by law in Rhode Island, we are required to do a market rate survey every 2 years. But interestingly enough, we are not required to keep pace with that market rate study. And so we are currently reimbursing providers at the 75th percentile of the market rate study that was done in 2003, 2004. And so we are 10 years behind. So the rates of reimbursement, and what that means is this is what the state pays providers, whether center-based providers or family child care providers, what they pay for a child that is being subsidized by the state. They're 10 years behind. And so when we talk about, this ties right back to the quality issue. Quality costs money. It costs money to have highly qualified teachers. When we talk about highly qualified teachers, we want teachers who have an education, an early childhood education, who have had the benefit of lots of professional development in child growth and development, in curriculum planning, in observing and assessing children. So all of that costs money. So raising the rates of reimbursement is a critical component of our plan to raise the quality of early learning programs.
So that is part of the early learning grants.
It is the Rhode Island Department of Education that is the home to the grant, although they are working in partnership with all of the state agencies, and that's something that they are examining very, very closely because they're keenly aware that the rates of reimbursement have a dramatic impact on the overall quality of a program.
And the other piece I'll add on that, the part of the other idea of keeping the rate of reimbursement, tied to the 75th percentile of the market rate survey, was that would enable families to access 3 out of every 4 providers if the 75th percentile market rate was in effect. So in terms of a family having a choice of what setting is right for their child, if the market rate reimbursement doesn't keep up with the cost of providing care and the cost of providing quality care, we're limiting the access that low-income children have to programs. And we're limiting parents' choice in terms of where they're able to place their child, because there's some areas of the state where the private paying families may be able to pay a little bit more for child care, and so a provider may say, I'm only going to accept one CCAP approved child at a time, or I can't accept any because economically, why would I? So if we really believe in closing the achievement gap, we do need to make sure that the reimbursement rates are lifted in terms of parent access.
Yeah, and that really goes back to the primary goal of the Race to the Top grant that Rhode Island received. Was it's not only to raise the quality of programs, but to ensure that more high-need children have access to those programs.
Well, great. So I think this is a lot of information that's been given out today. Are there places that families can go? Are there ways for them to learn about what's going on in early learning at the Early Learning Council and to participate in that process?
Sure. So I would certainly recommend that families go to the Bright Stars website. That has wonderful resources for families about how to choose a high-quality early learning program. I'd also recommend, if they're interested in learning more about the Race to the Top grant and what's happening to raise the quality of programs around the state, to go to Early Learning RI, which has information about the Early Learning Council and other activities that are happening under the Race to the Top grant. They could certainly come to the website of Ready to Learn Providence, where we have lots of information about professional development for the early care and education workforce.
Well, great. And certainly,
I'll put in a plug too. Yeah, of course. Our website is childcareri.org, where people can learn about family child care providers' efforts to raise up their profession, and parents. There's also useful links there for parents in terms of applying for child care assistance, that sort of thing.
Great. Well, thank you both very much, and we'll see you next time. Okay, bye.